Hey, welcome back. So I've been getting a lot of questions on this lately, and it's been in the news a lot recently. So what we're going to talk about today is drug recalls, specifically on a medication called ranitidine, commonly known by the brand name Zantac. Now what I'm going to do is break down what all this information really means, and then I'm going to give suggestions on what you should do if you take ranitidine or if you were planning to start taking it. So let's get started. So first, what does it mean when a drug is recalled? Well, this can depend on what triggered the recall and what type of recall it is. Sometimes the FDA will tell a drug company to recall some of their product based on a concern, and sometimes, and probably more often, drug recalls are actually voluntary by the drug company. Now, this can mean that the drug company found something themselves and they issued a voluntary recall to get those products back and then just inform the FDA. But it could also mean that the FDA basically informed the drug company that they need to recall some of that product and just sort of left the leeway to the company to fix the problem on their own. You may have also seen that major pharmacy chains like CVS and Walgreens have basically stopped selling all ranitidine products, both brand name and store brands. Now, this does not mean that something worse has happened. This does not mean that there's more information about it that makes it seem more unsafe. This is really just a business decision by these companies. The supply chain for prescriptions that come from the pharmacy is a little more controlled than the supply chain for pills that are sold over the counter. So when it comes time to deal with these recalls for businesses like this, sometimes it's easier just to pull all the products from the shelves. That way they don't have to worry about if they're selling some products to patients that may be determined to be unsafe later. They can just pull it all now, not worry about that. It's also easier on them as a business because they don't have to spend the time going through the different lot numbers and pulling specific lot numbers that may be part of a recall or making sure that they don't have any that are. It will save them the time of issuing refunds later if patients come back and want to get refunds on products that might have been recalled, and it will protect them from liability just from having sold products if something were to happen. So that is really just a decision that they're making because right now these products aren't going to sell a lot. So most of them are going to sit on their shelves anyway. They're not going to make a lot of money off of it during this time where there's a lot of concern. So really the companies aren't losing much money just by stopping sales of the product altogether for the time being. Okay, so what is ranitidine? Now, this is a drug that is called a histamine H2 antagonist. Now, this is a little different than drugs that you commonly hear about called antihistamines that you use for allergy symptoms and things like that, even though it's basically also an antihistamine. The difference is ranitidine blocks a histamine called H2, and antihistamines block a histamine called H1. Now, H2 is usually found in the stomach, and it's part of the process for making stomach acid. So when you take drugs like ranitidine, you're blocking the production of that stomach acid. So it's really helpful for people with conditions like heartburn or gastric reflux. So it's a helpful medication. So why is it getting bad publicity and what's wrong with it? And that's what I'm about to break down. The recalls on ranitidine are due to the presence of a contaminant that has been found in some of these products called NDMA. Now I'm not going to break down what that is scientifically. We're just going to call it NDMA. This is not in all ranitidine, and it's not part of ranitidine. It's just a contaminant that has been found in some of these products at low levels, according to the FDA. And we need to remember that this is specific to certain batches of product. Now, an easy way to think about that and to think about how batches of product are made with drugs is if you think about the raw ingredient of a medication like flour for baking. So you have this raw ingredient that's called the active pharmaceutical ingredient, or the API. Now, in this case, the API is ranitidine, and companies take the ranitidine, the API, and they mix it with other inactive ingredients, and that's what makes up the tablets or the capsules that you buy. So sometimes this API is made at the same place that makes the whole tablet, but usually they actually order it in bulk from companies that make and sell large batches of API. So there's actually companies out there that will make large batches of the product ranitidine, the flour product ranitidine, and sell it to drug companies that will then combine it with other inactive ingredients to make up the final product. So you have multiple steps along the chain with both the API and the inactive ingredients potentially coming from other places than the drug companies that make the products. So now when a drug company gets all these ingredients together and they make a product, every product that comes out is going to be in a batch. Now these batches are given lot numbers. A lot number is what you'll see on the packaging, and when recalls happen, they'll recall specific lot numbers. Now these lot numbers, each lot number represents a batch of drug that was made at a specific factory, typically on a specific time. So they can use these numbers to trace it back to where it was made, when it was made, what machines it was made on, and they can look at what API was used to make this product, and they can trace where that came from. Now most of these recalls are limited to just a few batches of drug that were made at one specific facility on a certain drug. And they can trace those back, and they can look at it and find out what went wrong there and try to fix the product. Larger recalls like this, where multiple drug companies are issuing recalls for the same medication, usually indicate that the problem might have started somewhere with the API or with other inactive ingredients that are used for these products that may or may not have actually started in the facilities that make the products themselves. So that's what the FDA and drug companies are looking at right now, is to try to see both what caused this problem to start and how much of this NDMA is actually present in these medications, so that they can determine if it's a safe level or not. Okay, so what is NDMA and why is it bad? Well, it's a byproduct of chemical reactions, and it's sometimes made unintentionally by laboratories and water treatment facilities. Now, this is not something new. This is something we've known about for a while, and we also know that there are trace amounts of it in certain foods and sometimes even in drinking water. But these are really low levels, and low levels of this aren't considered to be harmful. When we're looking at it in medications, we want not necessarily to be as concerned to whether or not it's there, but to how much of it is there, because there is an acceptable threshold, and as long as it's within that range, it's not considered to be harmful. So what are the risks of NDMA? Well, it's considered by the EPA to be a class B2 carcinogen. Now, what that means is we believe that it probably could cause cancer after a long period of exposure. We don't have evidence proving that, but we have evidence proving possibly in animal studies that it is a carcinogen, and therefore there's enough data there to relate that to humans, so we can believe that people would also develop potentially cancers from being exposed to this type of thing over a long period of time. Okay, so we know that this substance can be bad, but how likely is it to actually cause problems? Well, this isn't the first time it showed up in medications. If you remember, about a year to a year and a half ago, we also had problems, and they're in the news a lot, with certain blood pressure medications called ARBs. Now, these are drugs like losartan, valsartan, olmesartan. You may remember hearing about this too. These drugs showed up with levels of NDMA that the FDA decided were outside the threshold of a safe range. Now, the FDA also released information at that time estimating the risk factor of this. Basically, their estimation of the risk factor was that if 8,000 people had taken the highest dose of that medication that was contaminated in the blood pressure medications every single day for 4 years, it would be expected that one of those 8,000 people would eventually develop some type of cancer based on their exposure to that substance. So that is a pretty low risk, because it would mean that all those people would have had to take the highest amount every day, and it's kind of an extreme scenario, but at the same time, it's not an acceptable risk. When you're looking at the risk of one person getting it, yeah, that's pretty low, but the risk in a population where lots and lots and lots and lots of people take this is definitely an unacceptable amount of risk, and that's why there were so many recalls on those medications, and those recalls are actually still happening now. They're still working to figure all that out and get it sorted. So basically, what are the recommendations for people that are taking ranitidine? Well, as of right now, the FDA has given us no indication that they are high risk. It seems to be that the levels that are found of the substance in these products are lower than what we looked at with the ARB type blood pressure medications before. So it's considered to be a lower risk, but then again, this may also be a lower benefit to continue taking it. So it's really sort of a toss-up. If your doctor prescribes ranitidine to you to treat a condition, then definitely talk to your doctor before you stop taking it or try to change to something else and get his input on that. If you use it to treat yourself over the counter, well, for one, you might actually start having trouble finding it if other pharmacies are also going to pull it from the shelves. But at the same time, there's other options over the counter, so you could change to something else. Just talk to the pharmacist or your doctor before you switch to something else, because sometimes, especially if you're taking other medication, there may be other drug interactions or side effects that are different among the different types. But a couple of examples are drugs like famotidine and cimetidine. Those are two of the other H2 antagonists that are over the counter that you can buy. And some similar drugs that you can also get that are a little bit different type of medication but basically work to do the same thing are drugs like omeprazole and esomeprazole that are commonly known under the brand names Prilosec and Nexium. Now, these are two options that you can use in place of ranitidine as well, but once again, talk to your doctor, the pharmacist, before you change to that, just to make sure they're the right treatment for you. Okay, so that's all I've got. It was a little bit more than I thought it was going to be, so a little longer than I had expected, but I hope it gave you some good information. I hope it kind of explains some of the things that you've been hearing and maybe help you make a decision. So if you like this video, if it gave you some help, make sure to hit that like button, and if you want to subscribe, you can do that too. And I'm going to be putting out more videos, more information, some different types of videos, and if there's something that you're wondering about or want to know about, just go ahead and put that in the comments below, and I'll take a look at those and maybe make a video to help explain something else. Alright, thanks.